Today's COVID update is brought to you by Fulltech Systems, your technology center, where you'll come for the price but stay for the service.
And we're back. And if you're joining us right now, we're just getting our first segment for this morning started. And as we said before the break, we are going to be showing you how Channel 5 is going to have some of its own employees receive their second dose of the COVID-19 vaccine right here live on the air. And this is a follow-up to our news item which we showed you a couple weeks ago when some of the team did receive their first dose and now they'll be receiving their second dose. And here with us we have an entire team of medical workers, and we're going to be talking a little bit about the vaccine as well as showing you how the doses will be administered. So we have with us this morning, we have Dr. Aleida Pott, who is a medical officer from the Central Health Region, and we also have Nurse Donaldine Lizama, who is a public health nurse from the Central Health Region with the Ministry of Health and Wellness. And Nurse Lizama, I believe you also have some other nurses with you. Would you like to introduce them for us?
Yes, this morning we have Nurse Shawmela Kelly and Nurse Stephoney Heusener, who will be administering the vaccine, giving the vaccine to your staff here.
All right, and with us this morning, of course, we have Marlene, and some of the others from the Channel 5 team. We also have Duane Moody and Carla Heusener, and they are all going to be receiving their second dose. Are you guys excited?
I'm ready. I am ready. I can't say the same about Duane, but yeah.
Right.
Well, let me see the hands, nurses. Let's see if we have some gentle hands behind here.
Yeah. But of course, as you know, the COVID-19 AstraZeneca vaccine does require 2 doses. And Dr. Pott, why don't we talk a little bit more about the vaccine, how it works, and why it's important to get both doses of the COVID-19 vaccine?
Okay. For us here in Belize, we are administering both vaccines. We have AstraZeneca and the Sinopharm. Why it's important? Because it helps you to prevent you from getting any severe illness from COVID. It prevents you from ending up going to the hospital and going to ICU, you know, but it's very important you to put on your vaccine because we want to minimize the spread of the COVID here in Belize also.
Yes. And have you, at your respective workplaces, have you been seeing a lot of people coming in for the vaccines as well since the start of the administering of them in the country?
Right now, it's very hard getting people to get vaccinated. Reason why we are going out into different businesses, schools, different places to go and administer the vaccine. We have different vaccination sites at Swift Hall, at Central Health Region, at the clinics. We're doing vaccination, but our numbers are still very low, right? And this is the reason why we are going out now into the community to see who needs the vaccines, trying to convince people to get the vaccine and going into different businesses to get the vaccine done there at the business.
But can I say something?
Of course.
Yeah. We encourage the public to come in. As Dr. Pat mentioned, we have several vaccination sites in the city, and repeating them again, it's Central Health Region, Swift Hall, Cleopatra White, Matron Roberts. We have in the Kikaka, San Pedro, Ladyville, and then we have mobiles to our rural areas as well. The sites are open from 8 to 3 p.m. And right now we are at phase 3, so 1 through phase 3, healthcare workers, those over 60. Then we have those with special comorbidity, cancer, HIV, persons on dialysis. We have our teachers, our police, judiciary, National Assembly, BDF, Coast Guard, those with chronic conditions. We ask them to come out and get the vaccine. Also Red Cross, utility workers. Any of the vaccine sites. We have Matron Roberts that is open on Saturdays that also give the vaccine.
Yes, that's absolutely important information. So if you are in the Belize district and you are interested, those are either vaccination sites. If you fall into one of those categories, please go out and get vaccinated. Now, as you know, healthcare workers were in phase 1 and among the first people to be eligible to receive the vaccine. Ladies, have you all received yours?
Yes.
Both doses?
Both doses.
Okay. And so today our team is going to be receiving the second dose, so they will be fully vaccinated. Why don't we talk a little bit about how you guys are feeling about getting the second dose? Marlene, do you want to start?
Me, as I said earlier, for me, I was looking forward to getting the second vaccination. It's originally scheduled for tomorrow, but we were able to get everything coordinated for today. And, you know, I understand the importance of getting vaccinated. We are all exhausted with having to deal with all the restrictive measures of COVID. We're all exhausted of carrying all the fear and anxiety and concern for our loved ones. And so getting myself protected is important, but also that I am also going to be minimizing the risks for others around me as well. So I am ready to get fully vaxxed.
Sure. Carla, you want to talk?
Yeah, well, I had always intended to get it anyway, but a friend of mine in Mexico had a very, very severe case, and I will never forget the night when we were basically up all night, not sure if she was going to make it. And I don't want my children to have to go through something like that or even have to worry about it. I think they're going to be extremely relieved when I have both doses after my 2 weeks, and just want to get my life back, really. I think we all do.
Yeah.
For sure. What about you, Duane?
Morning, everybody. Well, outside of my fear for needles, you know, I think that in the profession that we're in, it's so necessary for us to get vaccinated, and because we interact with so many people from different walks of life on a daily basis, and so protecting yourself is also protecting them. And so I can totally see why we need to get vaccinated. And honestly, I would advise everybody else to get vaccinated. It does help with an additional layer of protection against this deadly virus. And really, right now, second dose, come bring it.
That's what you're saying, but you're shaking. Well, why don't you explain for us, Dr. Pott, just, you know, how the vaccination works?
Okay, when you come to the vaccination site, we still ask you to come with your social security. So you're required to bring a social security card with you. If you're getting the second dose, we ask you to bring also your card, because your card is going to be filled out and then it's stamped. Once it's stamped, it has the official stamp from Ministry of Health. You can use it for traveling or whatever purpose that you need. All right. We register you. I have downloaded on my phone a little what we call like it goes right into a Google Sheet, right, where you all your information is stored, and whoever else is on at the office, they can pick up your information and directly immediately put it into the system for us, right? Now, in the vaccination process, what we ask you your particulars, your information. We give you also a leaflet. Can you pass it on? A leaflet with information on it. This leaflet tells you more or less on what will happen to your arm. You have a little pain, swelling to the arm. We ask you, or we tell you that you can put a wash rag with ice or cold compression to your arm so that you won't feel that soreness. You also have fever, chills, tiredness, and headache. All right. Also, we give you ibuprofen or Tylenol at the vaccination site, so to help you with these symptoms. We also give you an emergency contact number at the bottom of the leaflet, so you can call us in case you have symptoms more than 48 hours, and the due date for the second vaccination, for the second dose of the vaccine. It's not on the card that you get, but on the leaflet that you get. People constantly mistake the date that the card has, the date on the card, with the date that they have on the leaflet, right? The date on the card is the date that you got the vaccine, the date of when you were administered the vaccine, not your second dose.
Okay.
All right. After that, you sit for 15 minutes. Wait for just to make sure that you're okay, that the vaccine didn't do anything to you. All right. You wait for 15 minutes. If everything's okay, then you can you're able to leave the vaccination site.
All right. Well, let's get started because you do have that 15-minute wait as well.
True.
So who's going to go first?
You did say bring it right, Duane.
I'm ready. I'm ready. Let's go.
All right.
What do you do when people are scared of
Yeah,
needles?
that was going to be.
What do you do when people are scared of needles?
We,
Huh?
we try to calm them down.
Yeah.
Talk
Yeah.
to them, try to distract them, ask them to, maybe if they're there with someone,
Uh-huh.
don't look at the needle, look at the person that you're with.
Okay.
Deep breaths as well.
Don't look at the needle. Okay, Duane is starting to hyperventilate. Do you want me to go first?
I'm looking at you.
Huh? Do you want me to go first? Okay.
Okay, so we've got Marlene up
All right.
first.
So, it's going to be on the arm that you don't write with, right? Okay, great. Yeah.
Ow.
And that was it.
And there you go.
Look at that. Didn't hurt too bad, did it?
Now officially with my second dose of the AstraZeneca vaccine. Definitely an important step in where we are with the pandemic. I'm not scared of needles, so that's part of it. But you know, it's a temporary pinch that you feel and then it fades.
Duane doesn't sound
All right,
so
Duane, you come
convinced.
to this seat here so that they can get you.
Let's do this.
Well, you know what's good is that a lot of people are scared of needles.
Yes.
And so you doing this really is going to help them too.
Nothing.
You sure
didn't have anything?
Nothing.
Yeah.
You never have nothing for breakfast this morning, do you? You sure didn't have anything for breakfast? Positive. You're almost there, Duane.
And there we go. You did it.
That's it.
That's it. It's
That's it.
done.
That's it.
Thank you.
Yes.
All right.
And now we've got Carla up.
Mm-hmm. 2 down, 1 to go. Now, I do want to let people know, of course, that a part of the reason we have been able to be in the, I think we're phase 2, is that we are frontline workers. We do interact with quite a number of people. And so the media also fell in that category. Gavin, you're up in 2 weeks, right?
Yes, I have
Okay.
received my first dose, and as right, but let's see Carla get hers.
You're almost there. It's finished.
And there we go.
There you have
Well,
it.
there we go. Thank you very much, nurses.
We
And
are-
now we've got 3 members of the Channel 5 team who now got 2 doses. They are fully vaccinated, but as Dr. Pott was saying earlier, it does take 2 weeks to become fully effective after your second dose, right?
Yes.
And
2 weeks after you get your first dose, you're ready to go. All right. Your second dose, sorry. You'll be able to not lose a little bit more your mass, but you still have to be very precautious so that you're not exposed. But at 2 weeks' time, you're good to go.
Now, that's a key part that we need to understand. The protection that is offered, you're less at risk, but it doesn't mean that you won't,
Yeah.
or you cannot, I should say, get COVID-19. Can you explain that for us?
All right. Once you're exposed to the vaccine, to the virus, you may or may not get symptoms, right? You still have a possibility of getting maybe the cold, the cough, whichever symptoms your body reacts to, right? But it doesn't mean that you're going to be very severely ill that you'll end up in the hospital. All right. You can manage it just like a flu-like symptoms at home, using whatever medications you have or remedies that you're accustomed to. You get over it and you can continue with life, right? But those people who are not vaccinated are more at risk, because those are the ones that can end up with severe illness and end up at the hospital.
How should we interact with people who are not vaccinated, even though we are?
Well, still do your precautions at home or wherever you are with other people. Still continue to wash your hands, continue to using your mask, do your social distancing. Until you guys can have enough people being vaccinated, then you can have your little herd immunity at home, you know. But as far as that, then you will still have to continue doing your precautions at home.
Okay. Now, ladies, having been on the front line since the beginning of the pandemic, I'm wondering what it feels like for you now to be at the point of where people are becoming fully vaccinated, you know, having seen all that you did last year and seeing what the public health system faced. What was that like for you, and what is it like to be at this point today? You can start, Nurse Lizama.
Originally, being on the front line, all of us, we were concerned because it was a disease that we did not know much about. We used our PPEs when we went out to do our swabbing or surveillance. Compared to now, it's a little bit less frightening, but we are still aware that that there are a lot of people out there that are not vaccinated. We still have to be precautious. We still have to be using our masks and maintaining our social distance.
Sure.
Just in terms of, you know, we've been getting reports where people, when they get their first dose, they might not see any kind of symptom or side effect of the vaccine. But it is when they get their second dose that is when they're seeing. I have to ask. That is when they're seeing.
Duane sounds a bit nervous.
Some kind of effect. You know, the first bout they didn't see anything, they didn't feel anything, no changes. But that the second time around they would. Is that something that you guys have been getting? That people have been experiencing that?
Actually, I think it's the reverse. What we have been hearing is that they had symptoms with the first dose, and with the second dose, the symptoms are very mild or not experiencing any symptoms at all. But we do let them know that you can get symptoms with the first and with the second. Don't get alarmed. They are normal side effects. If it gets severe, then you just call the emergency number.
And we have a little treatment pack that we usually get too, right?
Yes.
Which includes?
It's either the ibuprofen or the Tylenol that you get.
Okay. And that would help if I get a fever or
Yes.
a little bit of ache.
Ache, whatever. Fever, headache, any sort of body aches that you might have. That's what you get. You either get the Tylenol or the flu pack, or the ibuprofen.
What has it been like? Have people been coming back for their second shot?
Yeah, in some of the clinics, yeah, they do. Right now, we are still trying to get people out to come and get their second doses also.
Yeah. Tell us a bit about, you can hold it. Tell us a bit about what people are saying when they come in.
Okay, sometimes some of them are still scary, you know, despite some will receive no side effects at their first vaccination. You know, we have elderly there that comes up to 99 years old that have no side effects, right? Some has received their first vaccines and just with a mild temperature, a little bit of chills. The second one, there's no concerns, no complaints, no symptoms at all. So we do have in the villages that the elderlies are getting it. They're not scared. You know, up to the other day, I had one that was 100 years old and did receive the vaccination, the second dose with no side effects.
How are they? Are they relieved when they're getting their vaccine? Excited? What do they say?
They're excited. I'm vaccinated.
They probably want to go home and hug their grandkids.
And what they do in the villages, they encourage other people to come in to get their shots.
Mm-hmm.
Yeah, and on that note, earlier when we had just started the conversation, I think it was Dr. Pott who had said that or it was Nurse Lizama who was saying that we're still seeing sort of slow numbers and trickling. And so I'm wondering if you've had any conversations with people, and you've heard some of the reasons why people are scared, and what do you respond to those?
They're more scared of the side effects. So I usually tell them having a side effect is not bad, because you know that your body is building up antibodies, right? You're gearing up toward that immunity. So if you don't have antibodies, then you should be concerned. And Nurse Lizama told me, she's like, well, we didn't get side effects on our second dose, or we should be concerned, right? So I told her probably our antibodies already are there up high, so that we didn't have any side effects on our second dose.
You asked quite a few questions before we actually get the vaccination. Why is that information important?
It is important because at the end of the day, we have to hand in a report. Mm-hmm. So those reports, we have to put it in different categories, which phase they're in. Okay. So that's the reason why we ask those questions.
How do you feel as frontline workers when you know that people who are high risk are too scared to get the vaccination due to misinformation?
Well, that's the reason why when we go out there, we're doing health education also. We just don't go do vaccination at different places. We do health education, right? It's a team of us that go out to the different places to give not only the vaccine, but we start off first with our health education. We ask if there's any questions, concerns, difficulties, anything. We try to answer them as best possible. And then we look in to see how many people we have for vaccination, and we try to convince those who are not getting vaccinated at that point to convince them to get the vaccine. We have gotten, when we go out, we do get across to people. We try to convince them as much as possible so that they can be vaccinated.
What are some of the questions that they need answered?
About myths, there's a lot of myths
when
out
people
there.
are scared to get the vaccine, what do they need answers to?
We try to let them know that the myths are false. Recently, we had one person who stated that his mom got vaccinated, and by the vaccination site, a magnet was stick on the vaccination site, and obviously that person is reading or on social media, reading the myths. So we try to convince them that the myths are false. As well, there's concerns about blood clots as well. We try to answer that as well because we have had many people vaccinated. I can speak for the Belize district. We have not had cases of blood clots. We let them know that has not been proven as yet. The vaccine is safe to use. The benefit outweighs the risk as well. So those are concerns. Yeah. The age range as well. Some want to get those under 18 vaccinated, and we let them know that it's from 18 up. So they need to wait until we can vaccinate persons under 18.
Yeah.
And even though we have the different phases of eligibility, but those also include a big or diverse age range. Are you seeing differences in terms of who's more willing by particular age groups? Or the younger persons or maybe older persons are more willing to get the vaccine? Which, in your experience, what have you observed?
We are observing that the elderly are not coming out. It's those in their 30s, 40s, 50s, and we need to vaccinate our elderlies. Those are the persons that are at risk. Also, persons with comorbidity, they need to get vaccinated as well because they are very high risk. These are the persons that end up in ICU and on ventilators.
Why do you think the elderly aren't coming out? Is it sometimes too that they don't have access to come out of their house?
Well, that's the thing. we're there. Some people called us so that we can go to to different homes to go get the elderly vaccinated. We have had several home visits that we have done in order to get some of the elders being vaccinated. If at any point in time there is an elderly that can come to our vaccination site, the nurse usually facilitate them by coming out and going into the vehicle, get the person vaccinated so that they can take back the elders also out back home, you know. So we try to be flexible, as much flexible as possible, so that the elderly can be vaccinated.
So you can call and say, you know, I have an elderly person at home, can you come to me instead?
Yes, yes.
Oh, that's good.
Yeah.
That's good.
And I'm sure that a lot of people who are watching are probably maybe not have known about that.
Yeah.
So which leads me, so if somebody wants information or needs that service, or they just need some questions answered about the vaccine or how they can get vaccinated, what are the best ways to contact the ministry or you know, their nearest healthcare provider in order to get information or to get vaccinated?
Well, here in Belize at Central Health Region, we have this hotline, which is the 613-0787, the one that we put on the flyers. They can call us there and to ask us any questions or if they have any concerns or anything. We're there ready to answer any questions. Myself, I have gotten different questions and I've been able to answer anything that the public has been concern of, no?
Would you just restate where they can get the vaccine, the hours, and if they need appointments?
Okay. You can get your vaccine at Central Health Region. That location is the old nursing school building. A lot of people don't know that is the old nursing school building, but it's between Social Security and KHMH, that building at the back. We have Swift Hall, that is at St. Martin's. We have the different clinics, which is Cleopatra White, Matron Roberts, sometimes at Port Loyola, at Ladyville Health Center. We have at Key Cocker, at San Pedro. They are open from 8 in the morning till 3 o'clock in the afternoon.
Do they need an appointment?
No, you don't need an appointment to go. You can just walk in.
Where have you found the most people going out to get vaccinated? Like
Central Health Region.
Okay.
That's a vaccine site that we get.
So this is in Belize City?
Yes.
Okay. Good. Any final advice? I know you all have been in this fight from day one, when we knew so little about this disease to where we are now having people fully vaccinated. What do you want to say to the public?
Well, not to be scared. We're there for you. We can answer any questions, and I'm encouraging everyone to come out and get your vaccine. It's very safe. I have placed my one. I'm still here. I'm still standing. You know, because people have the feeling that when you put on your vaccine, it's like a death sentence. No, it's not. You know, so I encourage everyone to come and get your vaccine. It's very safe. It's very effective, especially AstraZeneca. And we encourage everyone to come out to give us a call if you have any questions or concerns or anything.
And from our hardworking nurses, what do you want to say to your patients that you have to always, I know you're being shy. I know you're being shy. Just, you work with your patients all the time. What do you want to say to them?
Please come out and get your vaccine. It's very important for you guys to vaccinate it.
I want to say the ones that has come out, thank you, and continue to encourage others to come in to get their vaccination.
I want to say the same thing to our elderlies to come out, to our teachers and police officers. They need to come out and get vaccinated. And we need to bring this pandemic to an end, and the only way we can do that is to get vaccinated. The vaccination prevents the spread of COVID, and people voice that they want to get rid of the mask, but the only way we can is to get vaccinated.
All right, so we hope that message is heard loud and clear. But of course, ladies, we want to thank you.
15 minutes is up, right?
Yes.
We survived, or
Yes.
I feel fine, perfectly fine. Duane, how are you doing?
I'm good.
Yeah, here we go.
I'm good. It was a good experience, man. The needle, you never really feel it.
That's right.
And,
Thank you, nurse.
you know, again, thank you. But some nurses, they're very heavy-handed, you understand? But I'm talking the truth, you know. But yeah, you know, they treat me with love, and you know, I'm vaccinated, fully vaccinated.
Carla,
Carla,
feeling
do you want to
fine?
say?
Yeah, I feel good. I didn't have any reaction at all in the first one, and right now my arm is totally normal. So, yeah, thank you. Thanks very much.
Okay,
Thank you
us.
all. We appreciate you having the early shift this morning to get us vaccinated. This is, of course, a critical part of encouraging people to go out. You know, I feel fine as well. We'll be finishing the rest of the show, and you know, we want to say to everybody else, get vaccinated. I know we're fully covered now.
Yeah, there we go. And I'll be receiving my second dose in about 2 weeks, and so I'm hoping that it's as good as you guys. But once again, Dr. Pott, Nurse Lizama, Nurse Kelly, and Nurse Heusener, thank you so much for coming in this morning and you know, administering the vaccine and educating us a little bit more, because you know, we can never stress enough the importance of the vaccine. So thank you. And of course, thanks to our team at Channel 5 too for coming out, coming on air and doing it live for all of our viewers, and also helping to encourage people to get vaccinated. So with that, we are going to be taking a very short break, and when we come back, we are going to be talking to the Companies and Corporate Affairs Registry. So please stay tuned.
COVID update was brought to you by Fulltech Systems, your technology center, where you'll come for the price, but stay for the service.